Welcome back to another episode of Discussions with Dr. G. I am your hostess, Dr. G, and today's episode promises alphabet soup, world-saving goals, and a story about PPE that's got just the right dose of nurse humor. So, in community health nursing, your world is packed with big names. Think WHO, UNICEF, CDC. All those acronyms you gotta learn if you want to make sense of who's really running the show, right? All right, so let's start global. The World Health Organization. Look, I always say WHO isn't just about eradicating diseases. They've got this massive definition of health. It's not just not sick, but actual physical, mental, and social well-being. Like if you're hitting all your life goals and not crying in the produce aisle, WHO would probably give you a gold star? Every 10 years, they come out with these huge targets. The current ones are all wrapped up in the Sustainable Development Goals. Stuff like clean water, gender equality, and, saving the planet before it actually catches fire. Then you've got UNICEF. Honestly, if you want to feel hope for humanity, look at what UNICEF's doing. It's like children first, always. Vaccines, nutrition, safe toilets, schooling, and a real push for gender equity. And they're everywhere, locally, or, at least stateside. You have all these federal agencies under the giant umbrella called Health and Human Services, HHS for short. You've probably seen the CDC in the headlines. The CDC is like the hype squad for outbreaks, responding when things go sideways, and also working on global stuff. If you're into caring for the vulnerable, HRSA is doing a lot behind the scenes, making sure folks get care, funding workforce training for nurses, and running things like organ and vaccine programs. And man, the alphabet soup just keeps going. NIH is in charge of research. CMS does the heavy lifting with Medicare and Medicaid. So basically, if your Nana or your neighbor's on insurance, CMS is in their business. And the FDA? Well, you want that rash cream or that new snack bar to actually not kill you? FDA's checking that out. Plus, SAMHSA, that's SAMHSA, mental health and substance use. Super important and sometimes overlooked. There's even more agencies like ACL, IHS, all focused on different age groups and needs. The Public Health Service Commissioned Corps, or PHSCC, is kind of like the Avengers of nursing. They're mobilized for disaster care, and yes, that means hurricanes and pandemics. Let's not forget OSHA, which is why you and I have PPE that actually fits most of the time. Okay, quick personal story. When I was still awkwardly new, OSHA updated their PPE regulations and we had this training session. All these new nurses, right? They rolled out this one-size-fits-all N95, and I kid you not, half of us looked like ducks. Everyone's giving side-eye, but trying to look serious so the educator doesn't see us laughing. But beneath the comedy, OSHA keeps us safe. Also, ODPHP is where Healthy People 2030 comes in. That's who sets the big vision stuff we're supposed to be chasing. And shout out to the NGOs and the Red Cross. Honestly, they step in a lot when systems get buckled. So what are all these powerhouses trying to achieve? Let's talk priorities. You'll hear about Healthy People 2030 a lot. And look, I agree. Those government websites are not what I'd call exciting. But their targets actually shape our practice. Fewer premature deaths, closing health gaps, building environments where people can actually thrive. Big stuff. And honestly, a lot of it sounds like no-brainers, right? Healthy eating, more physical activity. But then you remember not everyone has a safe grocery store nearby. That's where food deserts and food insecurity come in, which is a real chronic health problem linked to diabetes, hypertension, you name it. Agencies like the USDA are trying to help with programs like SNAP and WIC, but it's tough out there. Globally, we're now forced to think beyond just diseases. Climate change is upping the number of heat illnesses, damaging food and water supplies, and pushing people out of their homes. I mean, hotter summers, wildfires, new patterns of disease. It really is all connected. Throw in stuff like human trafficking. That's this really dark reality a lot of nurses simply aren't trained to recognize. And then, of course, pandemics, right? If COVID-19 taught us anything, it's how quickly our priorities can shift. Suddenly you've got equity issues, misinformation, and resource shortages in your face. Here's what bugs me though. Everyone scrambles when there's a pandemic, but what about the slow burns? All these underlying issues like food insecurity or violence, they get less spotlight even though they're killing people way before any virus does. As nurses, that puts us in a weird spot. Do we follow the headlines or do we keep pushing for better food systems, safe neighborhoods, and just basic dignity for everyone? My take? You fight both battles. You stay ready for crisis, but you don't let the silent stuff get ignored. That's where the heart of nursing really is. All right, last stretch. Let's talk about how everything is changing and fast. Technology is a double-edged sword. Health informatics is in every patient record, every appointment you book, and let's not pretend telehealth isn't here to stay. My older patients loved it, well, the ones who could figure out Zoom. But making sure everyone gets equal access, that is still a problem. There's always this privacy thing too. Suddenly Aunt Linda's whole medication list is on her nephew's iPad and you're like, how secure is this really? Demographic shifts. Huge. The patient population is aging. Chronic illness is going up, and that means more need for home and community-based care. Oh, and nurse shortages? Don't get me started. My clinic during COVID felt like a revolving door. You're juggling way more patients, half your usual support, and still expected to deliver gold standard care. That's why population health has gotten so much attention. It's about seeing the big picture, social determinants, cross-sector collaborations, and focusing on real core competencies. Listen, nursing isn't just about giving meds on time or knowing your anatomy. It's assessment, policy development, fierce communication, my favorite, cultural humility. You're not the expert in every patient's lived experience, and that is a non-negotiable. Then there's the quad council domains and CUSIN stuff, teamwork, evidence-based practice, quality improvement, all that jazz. It's a lot to keep track of, but that's what makes you a great nurse, not just a technically good one. So, to all those new grads or soon-to-be nurses listening, here's what I'll leave you with. Know the system. Keep the big goals in your sights. Tackle disparities. Use your tech smartly, and don't let your advocacy muscle atrophy. Community health nursing, it changes every single day, and that's exactly why it's worth doing. Thanks for hanging out. I'll catch you next time for more real talk stories and a little more sarcasm about my cat's opinion on nursing shoes.